So getting your life back, and people are watching now thinking, okay, great, you know, easy answer, and for you it's working, but tell everyone, Dr. Dasgupta, what Trinity's talking about in terms of her new treatment.
Well, we're talking about GHB, gamma hydroxybutyrate, and when we talk about that...
Wait, now GHB is, you know, what everybody has come to know as the date rape drug.
Yes, that is the stigma that comes with it. But a couple of interesting things to say about it. Do you know that me and you, we make GHB in our body. Our cells make a very small amount of it, but we don't know what its role is 100%. We hear GHB in people who are bodybuilding, people who are athletes. Why? Is because GHB promotes sleep. Not just any type of sleep, you get what's called slow wave sleep. And during that stage of sleep, you secrete a very specific hormone known as growth hormone, which is why athletes and bodybuilders were using it. But people who have chronic fatigue, known as fibromyalgia, people with chronic pain have used GHB off-label to try to help these issues. But when we talk about using it therapeutically, we're talking using about a metabolite, a derivative of GHB known as sodium oxybate. And that's specifically what she's referring to.
And let's step back, because I'm sure what everyone's thinking is, okay, GHB, date rape drug, you're mentioning it using as promoting sleep, and yet Trinity's issue is she feels sleepy all the time because of narcolepsy, so wait a minute, you're using a drug that makes people sleepy to treat, what?
It is confusing, isn't it? It works on a receptor called the GABA-B receptor. So what is narcolepsy? A dysregulation of your sleep and wake cycles. You're sleeping and waking up at the different times. What sodium oxybate does is prevent these GABA-B receptors from releasing dopamine, norepinephrine, which are alerting hormones, because people with narcolepsy wake up all the time at night.
So it allows them to have restful sleep at night? So
but in the morning, whether it be GHB or sodium oxybate, it's short-acting. So in the morning, you get that release of that stored up dopamine and norepinephrine, making you alert during the day.
So it's totally different than treating it like you were, which is with stimulants throughout the day trying to keep you awake, but you're so tired it doesn't matter. This is really getting to the root of the problem. Now, very complicated. You mentioned something I think is really important. I love your story because it's really difficult to get you at the right dose.
Correct. Yes, it definitely took 3 to 4 months. And the side effects are very, very challenging.
Do you still have the side effects?
No, I don't have those side effects.
Because a lot of patients don't hang in past side effects.
Exactly.
I don't hang in past side effects.
Any concerns because you hear about a drug being called a date rape drug, and obviously it's a drug that is regulated. Trinity, I know this isn't something that you just roll into your average pharmacy and say, I want, you know, this GHB here. It's number one, it's very difficult in terms of some countries. It's not even available due to regulation.
Yeah.
How do you find the balance here? We've talked about this with some other recreational drugs and that may have therapeutic benefits. Where do we find the balance so this doesn't get into the hands of the wrong folks?
Well, I think the big thing being the doctor-patient relation. If you're going to see someone and you're going to start sodium oxybate, you want the family to be there, loved ones to be there, and take your time to explain. And I think the hardest thing and the best thing about narcolepsy is that there's not a cookie-cutter answer to all the problems. You take every patient as an individual. And I think that Xyrem is not a drug for everyone, sodium oxybate, but I think that you need to know what the side effects are, and there's some people who shouldn't be on this medication. If you have liver damage, it gets metabolized by the liver. If you're someone who has depression and anxiety, this may not be the medication for you. If you have weight issues, anorexia, I'm not going to give you Xyrem. So I think that there's certain people you have to choose your patients correctly and wisely.
And clearly, Trinity, you're someone who's doing quite well with it. We're just happy that you've got your life back.
Yeah.
We wish you all the best in life. Always a pleasure, Dr. Dasgupta. Thank you for your input. We really appreciate it. And Trinity, thanks again. We'll be right back.